Hi, thanks for checking us out. We're here to talk about improving your health by staying up to date with your healthcare provider. Did you know that it's possible to connect online to find your test results, refer to notes from your visit, request prescription refills, schedule appointments, and exchange secure messages with your provider? That's a lot of power in an online application. Once you have connected to the application, the rest is simple. In this video, we will cover how to reach the application from your personal computer or PC and your mobile phone. The application will have a different brand name depending on your provider, but in general, it is referred to as a patient portal, and that's what we'll use for this demonstration. What's required? A PC with an active internet connection, or a smartphone with an up-to-date operating system, an active data plan, or Wi-Fi connection to the internet. In both cases, you'll also need to be able to receive email messages and text messages. Let's look at connecting to the patient portal on your PC. First, make sure that your PC is turned on and connected to the internet. Then, open your internet browser. This may be Google Chrome, Microsoft Edge, Mozilla Firefox, or another. In the browser search bar, enter the name of your healthcare provider's organization. We'll use the University of Kansas Medical Center as an example. Begin typing the name of the provider organization into the search bar, as we have done here. Then press enter. Once you connect to that website, look for a link to the patient portal. Sometimes this link is very obvious. Other times it requires a little checking. You can look for something on the homepage that deals with patient systems rather than the medical center. Once we reach the health system's homepage, we look for a link directly to the patient portal or something to do with patients. Also, there may be a link for a patient login. If you can't find any obvious link, look for patient account or patient records. Sometimes providers have given a name to their portal, often beginning with my, that is MY. In this case, we can see a link for my chart in small letters at the top of the page. Let's select that to reach the login or sign in page. The sign in page usually has sign up or create account options. If you can't find a portal or a sign up page, it's possible that your provider controls access by sending out an invitation email with a link to the portal and temporary sign in credentials. You can check this by calling the provider to ask to receive registration information by email. As you can see from our current example, you can sign in if you are a current user, or you can sign up as a new user. Let's act as a new user and select Sign Up Now. You are taken to a page that requires an activation code. In some cases, you would need to contact the provider and have them send you a portal invitation email with the appropriate information. In this case, you haven't received that email, so let's look for another option. It appears that we can proceed by selecting Sign Up Online in the selection on the right that asks whether we have an activation code. This is where the provider begins to check the information for the patient, you or someone you are helping. Certain information is required, identified here by red stars. Your information must match the information in your medical record. Fill in the required information: first name, last name, street address, city, state, zip code, date of birth, legal sex, email address, verify email address, and then social security is not required. When you have accomplished that, select I am not a robot, then press next. Some systems may require more information to validate the patient. They may send a code to your mobile phone or email that you plug into a form to proceed. Here, the system is asking a series of challenge questions. You select the correct answer from the options. We'll just use one sample question here. It asks from the list below, what is the area code of the phone number ending in a certain number? Select the appropriate area code, but don't be afraid to answer none of the above if none of the options apply to you. After this, the user is asked about two-step verification. This means that you have the option to receive a code each time you attempt to log in. It is a second step to signing in and is more secure. In this case, let's decline the option. You are asked, are you sure, to verify. For now, let's opt to turn off two-step verification. At the next screen, you select Continue. Now it's time to select a username and password. In many cases, people choose to use their email address as their username. When choosing a password, be sure to choose something secure. Remember, This portal has your health information. When you are done entering your choices, press Next. Some browsers will ask if you want to save the chosen password in the browser. See the box in the upper right hand of the window. It is advisable to answer no or never, unless you are the only person who uses the computer on which the browser is running. Again, you want to protect your health data. On the next page, you'll be asked for your email address and mobile phone number so that you can be alerted to data updates and messages that you may receive in the portal. This page also provides the ability to sign in for the first time on the portal. First, the user must accept the terms and conditions. This portal includes an instructional video, but the user can skip it. This user is now in the portal. This page offers a view of your appointment schedules and a view of your clinical team. It also has tabs in the upper panel that you can select to connect to, see and schedule appointments with providers, exchange secure messages with the clinical team, review documentation related to visits, view test results, check medications, and renew prescriptions. Also, if you select the three bars at the upper left corner of the screen, you will see a menu of additional options with the portal. So as you've seen, the patient portal offers a wealth of data and functions to help you manage your health. And the registration process is similar to the registration process for other kinds of secure applications. You can follow these instructions for every organization from which you receive care, hospital or primary care office, or if it's a different organization from the hospital and possibly each specialist, like a cardiologist, dermatologist, ophthalmologist, and psychiatrist. If you would like to get the application on your smartphone, you need to know what name your healthcare provider has given to their portal. Then you can find it by that name on the Apple App Store or Google Play Store. Then download it and open it. From there, the process is basically the same. Either sign in or register. So that covers most of what you'll encounter when registering for a patient portal. We hope that you have a happy and healthy experience.